Understanding diabetes, causes, symptoms, and management. Diabetes is a chronic health condition that affects millions of people worldwide. It occurs when the body cannot effectively regulate blood sugar, glucose, leading to elevated blood glucose levels. Over time, this can cause severe health complications, but with proper management, people with diabetes can lead healthy and active lives. Types of diabetes. There are three main types of diabetes. Type 1 diabetes. This is an autoimmune condition where the body's immune system attacks the insulin-producing beta cells in the pancreas. As a result, the body produces little to no insulin. It often appears in childhood or adolescence, but it can also develop in adults. People with type 1 diabetes require insulin therapy for life. Type 2 diabetes, the most common form of diabetes. Type 2 occurs when the body becomes resistant to insulin or doesn't produce enough insulin. It is often linked to lifestyle factors such as poor diet, lack of exercise, and obesity, though genetics also play a role. Type 2 diabetes usually develops in adults, but it is becoming increasingly prevalent among children due to rising obesity rates. Gestational diabetes. This form of diabetes develops during pregnancy and typically resolves after childbirth. However, women who have gestational diabetes are at an increased risk of developing type 2 diabetes later in life. Causes and risk factors. The exact cause of diabetes varies by type, but common risk factors include genetics. A family history of diabetes increases the risk. Obesity, excess body fat, especially around the abdomen, contributes to insulin resistance, a key factor in type 2 diabetes. Age, risk increases with age, especially after age 45. Lifestyle, a sedentary lifestyle, poor diet high in processed sugars, and a lack of physical activity are major contributors to type 2 diabetes. Type 1 diabetes is primarily linked to autoimmune reactions, while gestational diabetes is related to hormonal changes during pregnancy that affect insulin function. Symptoms of diabetes. Early detection is critical for managing diabetes and preventing complications. Common symptoms include frequent urination, polyuria, excessive thirst, polydipsia, unexplained weight loss, fatigue and weakness, blurred vision, slow healing sores or frequent infections, tingling or numbness in the hands or feet in type 2 diabetes. In some cases, symptoms may develop gradually, especially in type 2 diabetes, leading to a delay in diagnosis. Complications of uncontrolled diabetes. If left untreated or poorly managed, diabetes can lead to a range of serious complications, including cardiovascular disease, increased risk of heart attack, stroke, and atherosclerosis. Nerve damage, neuropathy, tingling, pain, or loss of sensation, particularly in the extremities. Kidney damage, nephropathy. Severe cases can lead to kidney failure. Eye damage, retinopathy can lead to blindness if untreated. Foot problems, poor circulation can lead to infections and, in severe cases, amputation. Increased risk of infections. Diabetes weakens the immune system, making infections more common. Diabetes management and treatment. Managing diabetes effectively requires a combination of lifestyle changes, monitoring, and medical interventions. Key elements of management include blood sugar monitoring. Regularly checking blood glucose levels is essential for people with diabetes to ensure they stay within a healthy range. Medication. Insulin therapy, used by people with type 1 diabetes and some people with type 2 diabetes. Insulin helps regulate blood sugar levels by allowing glucose to enter cells. Oral medications. In type 2 diabetes, medications like metformin can improve insulin sensitivity or help the pancreas produce more insulin. Healthy diet. A balanced diet rich in vegetables, whole grains, lean proteins, and healthy fats can help regulate blood sugar. People with diabetes should minimize their intake of processed foods and simple sugars. Regular exercise. Physical activity helps improve insulin sensitivity, enabling the body to use glucose more effectively. Exercise also aids in weight management, which is crucial for those with type 2 diabetes. Weight management. Maintaining a healthy weight can help manage type 2 diabetes and reduce the risk of complications. Routine medical checkups. Regular visits to a healthcare provider are important for monitoring blood sugar levels and managing potential complications. Prevention and early intervention. While type 1 diabetes cannot be prevented, the risk of developing type 2 diabetes can be reduced through lifestyle changes, such as maintaining a healthy diet, staying physically active, and managing weight. Early diagnosis through regular screening, especially for those at risk, can help delay or prevent the onset of complications. Conclusion. Diabetes is a serious condition, but with proper management, individuals can lead healthy and fulfilling lives. Understanding the causes, recognizing the symptoms, and embracing a proactive approach to treatment are key to living well with diabetes. Continued research and innovation in diabetes care offer hope for even better treatments and potential cures in the future. If you or someone you know may be at risk for diabetes, consult with a healthcare provider for appropriate screening and advice on prevention and management.